leisure, and business radio.
In the heart of Accra, nestled in the vibrant neighborhood of East Legon and New Beacon, a 360 multimedia firm has emerged. Introducing Zed Multimedia. With a steadfast focus on lifestyle, leisure, and business, we set out to bring high-value oriented programs that captivate the taste and desires of our audience. From the captivating airwaves of Zed 101.9 FM to the dynamic visuals of Zed TV and the innovative realms of Zed Digital and the incubation of advanced technological knowledge at Zed Tech, every facet of modern media is meticulously curated to engage and inspire. Also, let's not forget the new Finder newspaper, now under the Zed Multimedia umbrella, delivering insightful journalism with a business focus. Join us on the journey where innovation meets inspiration, where lifestyle meets leisure, and where business thrives. Change is here. Zed Multimedia, your lifestyle, leisure, and business platform.
It's your lifestyle, leisure, and business radio.
Good afternoon and welcome to the Zed Wellness Link. My name is Dr. Padiaite and I'm your host. I can put it on. Today, we are discussing what to do in an emergency, a medical emergency, accidents, poisonings, and sudden collapse. Medical emergencies can occur suddenly. Most people are unprepared as to how to respond to them effectively. These include accidents, poisonings, and sudden collapse. All require quick action, prompt first aid before professional help arrives. Knowing what to do in such situations can save lives and reduce the severity of injuries and prevent long-term complications. Today, we shall discuss what to do when faced with these emergencies. The common mistakes to avoid and the importance of preparedness at home, in school, and in the workplace. Our guest has a double barrel name. He's Dr. Emmanuel Steve Blankson, an emergency medicine fellow at the Kolebu Teaching Hospital. So we are speaking to the right person.
Yeah.
He's going to teach us what to do when we are confronted with an emergency.
Yeah.
Dr. Blankson, you're welcome.
Yeah, thank you very much.
So I'll just give you a personal experience.
All right.
I was driving on the Legon Road. This is more than 10 years ago.
All right.
And okay, so the first time I was driving on the Legon Road, then somebody's car tire came off. And the car tire left his car and crossed the road to come towards me.
Oh.
First of all, we saw the car had left his lane and came towards my lane. So I swerved left to dodge the car. Then the tire followed. I had to swerve left again to dodge the tire. But soon after that incident, same location, we're driving in front of, that's in front of Legon. And then we met, there's an accident. A BMW 5 Series, dark color, that somebody had hit. And so driver's side had been hit. There was a lady in the car. The car, surrounded by people. I looked, I was like, should I go? Should I park? And I parked. And I went there. And then people were trying to force open the bonnet. Hey, battery, I said, 2 battery. Giddy. Then people the door had jammed. They were trying to force open the door. It wasn't opening properly. They grabbed the woman. They were pulling her out. Her leg was trapped inside the, between metal and seats. And the people were pulling the woman, shouting, like, hey, Radde. So, observing the situation, I went to the other side of the car, went into the car, spoke to the woman, managed to get her to move there's somebody put a jack inside there trying to jack this thing off. But managed to get her to move the power of the seat was still working. Okay. Move the seat back. Yeah, and then we were able to get her out of the car, but it was chaos. And it took quite a while to convince people that don't pull her. Yeah. Just leave it. Yeah, you're worried about the battery. Continue the battery, but you don't pull her. Let's figure out how to get it out. But then it just shows unpreparedness for emergency. And it's as if the average person on the street does not know what to do. If you see the way they carry injured people, there are people who have suffered cervical fractures, that's fractures of their neck. Just because of the way they carry them, they will die. Yeah. They will die. Yeah. They carry them like they are dead bodies. Then one leg is here, one arm is there, and your neck, your spine is, rotating all over the place. Dr. Blankson.
Yes.
Please, today, tell us what to do.
Sure.
My first question, what exactly qualifies as a medical emergency?
All right. So that's a big one. It's very broad. But basically, if we want to narrow it, it's any medical condition that is life-threatening or that may result in loss of a limb or vision, or any distressing medical condition that needs urgent medical attention. So basically, the life-threatening is straightforward. We know that life is at risk. But beyond that, we have to also know that some conditions that threaten the limb, like if you don't act urgently, you may lose a limb. That one also qualifies as an emergency. Then things that may affect your vision, so that it will lead to visual impairment or permanent visual loss. So that's also one, that's also qualifies as an emergency. Then the other distressing things that need urgent medical condition, so maybe for the layman it may be a bit difficult, but something like testicular torsion. So in itself, it will not kill you, but if you don't manage it urgently, it will lead to permanent disability or dysfunction of that organ.
But testicular torsion, you're talking about the testis.
Yes, that twist.
So if the testis twists, blood supply will not come to the testis.
Yes.
That means the balls will die.
Yes.
So say so, you are saying it.
Yeah. So
your balls will die.
Yeah.
Hey, that's a very important thing.
Yes. But technically, somebody may say, okay, it's not a life-threatening, you won't die and all that, but it's also recognized as an emergency. Yes. Okay. Yes.
All right. So all those things are emergency.
Yes.
If you drink, if your child drinks kerosene or acid, or those things. Okay. Yeah. If you get into a road traffic accident,
all of them,
and you are bleeding,
a
sudden collapse, diabetic crisis.
Yeah.
All of
so
them.
all of them, those are life-threatening. So
Okay. So let's start with accidents, because
Yes.
that is where we seem to have the biggest
a lot of problems.
headaches. If an accident occurs and you get onto the scene, what are you supposed to do?
Okay. All right. So there is
Ladies and gentlemen, this is the most important part of the entire program.
yes.
What
yes.
are you supposed to
to
do?
do. So when you get to the scene and you want to help, the most important thing is scene safety. So the example is that maybe there is a road traffic accident and maybe smoke is coming from the car and part of it is dripping maybe with fuel or petrol and all those things. In your attempt or haste to try and help, if you don't take care, it will explode, and then by the time you realize, you also become a casualty. Or maybe there is a building has collapsed, and maybe there is some electrical fault or something. So if you try and go into the scene without making sure that the scene is safe, you may have problems. It's similar way, maybe a loved one maybe falls into a pool. You don't know how to swim, but you want to also go and do it. And just for context, the September 11 unfortunate incident that happened, it's reported that many more people died, many more first responders died than has ever existed, in the history of the United States. So a lot of the people who died initially, the first crash that happened, they rushed in to go and help them. Then the building collapsed, and all of them were trapped inside the debris, and then they also ended up dying. So scene safety is very, very important. If it's a road traffic accident, make sure you block the traffic or you have somebody who is directing it so that you don't start doing anything in the middle of the road. Having done that, you have to start the pre-hospital care. And in our case, you can call the National Ambulance Service because you will need help in order to save the person.
So ensure the scene is safe for you.
Yes.
And for the other people.
Yes.
And then call for help.
Yes. Okay. And then you call for help. Beyond that, if you are a lay person and you don't know any other thing, that will be just okay for you to do. Because if you don't have any training and anything at all, at times you trying to do something may rather cause more harm than good. Yeah. So you make sure the place is safe. You call the ambulance, and then you wait till you get help. Yeah. But if you have some training, you may be able to go and talk to the people. If they're able to talk to you, it means maybe their airway and the breathing is a bit fine. Then you know whether you can help out with other basic stuff. Yeah.
So are you saying that for the untrained person, don't do anything?
Yes. This may be a bit, I don't know, maybe difficult to take, but at times you trying to do something may
you can actually make it worse. That is so true.
Yes. Yeah. So, but in actual fact, you trying to make the place safe and you calling for help will actually increase the person's chances of survival. So it's not really like you've not done anything. Just that maybe you would have wanted to touch, move certain things and all that, and maybe it may be beyond your capacity. Indeed, at times, like what the scenario you gave, even as healthcare workers, you may look at the scenario and you will see that there is very little you can do on the scene. Yeah. So they have the so-called some principle, the scoop and run. So it's like you urgently try and get the people from the site and get them to where they can really get help. Then you know that you minimize their chances of having any untoward outcome. Yeah.
Okay, so what do you do if somebody is bleeding?
All right, so for bleeding, we are assuming the scene is safe. You call for help
scene
and all
is
those
safe,
things.
Call for help. Person is not like trapped or anything. He's come out. He's bleeding from an arm or a leg or something. All
right, so the first thing to do is to apply pressure. And that one, if you, the person, the victim, you are even conscious and alert enough, you could actually do the pressure dressing. I have actually also had an accident before on the Kintampo Road, and I had a bad scalp laceration. So it was the first thing I did, and I used my handkerchief. So you can use anything, handkerchief, headgear, shirt, singlet, anything at all. Some of the guys who have bandana, you can do it. Or even if you don't have anything, you can actually use your hand to just press on it. The pressure dressing will more or less, reduce the bleeding or stop it. If the bleeding is on the limbs and it's something that's beyond the pressure dressing, you are not getting much result, you can raise it up. Medically, they will say you elevate the hand or leg. So when you raise it up, it may also reduce the bleeding further. And for bleeding that do not stop, even when you've done all these things and the person is really bleeding, you can apply a tourniquet. It's like vertically, you use anything, like the way you say, maybe a shirt, long sleeves or whatever, to tie just above the injured limb. Yes, and you tie it.
You can use your belt.
Yeah, you can use your belt, anything at all to make sure.
I think belt will be.
Yes.
Belt will be.
Yeah, for the men.
You take a belt off.
Yeah.
Fix it there and then lock the belt. So
yes. Yeah, but anything that comes to mind, like if it's handy, rope, is there
shirt,
rope, anything, you have to do it, because that one. Let me tell.
Maybe your head you can't tie on.
No. You can't. Obviously, you can't do that. But basically, when you do that, you stop the bleeding. When you do that, you have to quickly get the person to the hospital so that they manage that part and prevent the person from just bleeding or bleeding to death. Yeah, and actually we had a case like that. I think that person was operating on a louver blade, and one of them cut him in the arm. So one of the arteries in the elbow, the vessels, they were really bleeding. And indeed, the guy survived because his friends, the boys, they used a cloth to tie it. And then they rushed
him. So they tied above it, not on the wound.
No, on the wound.
Tied above the wound.
Yes,
okay.
yes. So they tied above the wound and then quickly rushed him. When he came, we continued the resuscitation or continued reviving him, gave him things, blood and all that, and then he went to the theater to get it fixed. But if you look at the way, even with our pressure dressing and all that, the way he was bleeding, you could see that if they had left him,
he would have died before.
He would have died before. He arrived. Yeah.
Yeah. I've seen one of those before. It was really
bad. Yeah.
We spent the whole night at Kwelebu, but plastic had to repair.
Yeah.
It was an arm, so blood vessels, nerves, to be able to get him back some function.
Sure.
It was horrible.
Yeah.
It was horrible. Okay, so that's what we have to do in bleeding.
Yes.
Now, why don't we want the patient to be moved by unskilled people?
All right, so in medical parlance, they call it extrication. So at times when a patient is trapped, you need a set skill to be able to get the patient out without causing further damage or injury. Particularly, we are more concerned about the spine. That's the bone, the backbone. And in the backbone, there's a big, so the spinal cord or something that's more like electricity gives power and sensation to a lot of, the hands and other parts of the body. So what happens is that if you, in your attempt to just try and help, you just move the person like that without keeping the spine straight or stabilizing the spine, then the person may have a cord injury. And by the time you realize he may be alive, but he can't move, he will be paralyzed forever, like every part of his body. And indeed, some of the paralysis could be so bad that it may even affect his ability to breathe. So that's why we do that and advise that you don't try and just take the person out of the vehicle. Indeed, some of the things may be so difficult that even for the trained people like the paramedics, they may not be able to get the person out. They may need fire service or other people to cut certain things so that you'll be able to gently get the person out.
In a manner that will not cause them harm.
Yeah.
Not because they can't pull the person out, but because it will cause more trouble.
Sure.
I have seen that in other places, with an accident like that, they put a collar on your neck before they move you.
Precisely.
That is to
prevent you from having any maybe C-spine injury. So that's the backbone, the one at your neck especially.
Yes.
Yeah. So because you don't have those color and all those things, that's why you have to let the ambulance team who have
because
all
they
those
have
things,
the collar.
They have it. So
you fix it for you before they move you.
Yeah. Probably you could tell the person to just be still and not move or turn his neck. That would be a good advice, but it will not be advisable for you to just take the person out because you will not know which type of injuries the person has.
So you should stop pulling people out of vehicles.
No, we should stop, and then we hope that our ambulance will respond appropriately.
Quickly enough.
Sure.
Ladies and gentlemen, we are going to take our first break, which is the name of Jesus. We are playing The Name of Jesus by Diana Hamilton. Please stick and stay.
Zed 101.9 FM.
press gently. Don't press too hard, otherwise you faint.
Yeah.
And see if you can feel a pulse.
Yes.
So that now you know where to look for in case something happens.
Yes.
And you feel a pum, pum, pum.
Yeah.
Is that right?
Yes.
So that will be your own pulse.
Yes.
So that is what you will look for in the event of somebody has collapsed.
Yeah,
so you want to know if there's a pulse. If there's a pulse, it means what?
It means the person's heart is beating.
Okay.
So then what you need to do is that if he's not breathing, you can put him in a certain position, like try and elevate, try and let the head go up a bit, like the way if you are sniffing.
So you try and raise the chin.
The chin, yeah, and tilt the head. Okay. So that, like the way if you are smelling something, the sniffing position. Okay, that one will allow air easily into the lungs. Yeah. And you may be able, if you are comfortable, you can do the mouth to mouth. Maybe if the person is a close relative, you can do it.
Put the handkerchief over between the two of you to protect you against rabies.
Yes. So you can do it, and if you're also comfortable, and the person is not even close to you, can also do it. Although there are concerns for infection and the rest, a lot of studies have said that just doing that for a brief period doesn't really, the risk of you getting any serious infection is not really that significant. Okay. Just that if you are not comfortable, you can just concentrate on the pulse and see. Yeah.
So with mouth to mouth, you have to block the nose, or you don't have to block the nose.
You just have to.
You've elevated the head.
Yeah,
you've raised the chin.
Head.
You've raised the chin.
Yes.
The head is bent back. You've raised the chin.
Yeah. And then you open the mouth. Yeah. And then you take a deep breath and then blow
it into the person's
force
mouth.
It. Yes.
But you don't block your nose.
Yeah. So no, you don't. You
don't need to block the nose. You have to block the nose.
Yeah.
You see them, you are blocking the nose.
Yes.
Okay. So that is this thing.
Yeah.
So that's assuming the person is not breathing. You can help the person. You can breathe for the person until the emergency steps. All right.
Yes.
Assuming the heart there's no pulse. The heart is not beating.
All right.
What do you do?
So if the person is unresponsive, heart is also not beating. The assumption is that you've already called the ambulance team. So you start what we call CPR, cardiopulmonary resuscitation. In normal terms, you use your 2 hands, you lock it, and you press on the chest between. Please
describe the thing, though.
Yeah.
You use your 2 hands.
Yeah, you lock it. You lock.
No, where do you put the hand?
So the hand let me use a man. For a man, just get a space between the 2 nipples.
Okay, and man, between the 2 nipples.
Yes.
In the center.
Yes, in the center.
That's where you put your hand.
Yes, and then you lock your hand.
Which part of your hand do you put there?
So you lock it and like the heel.
The heel. The heel is the part of the hand which is near the wrist.
Yes.
So it's at the bottom of the hand.
Yeah.
So you put the bottom of your hand
over
in the middle of the chest.
Yeah.
Lower chest, just between the 2 nipples.
Yes.
And then you put your other hand on top of it.
On top of it, you lock it.
And lock the 2 hands.
Yes.
So it's like this.
You lock it.
Like this. And then we use here.
Yes.
This part.
Yes.
To press onto the chest.
To press it. Then you use your whole weight to press it.
Use your whole weight to press it.
Yes.
Okay. And how do we press it?
So we recommend that you do 30 compressions. So you press it 30 times.
30 times.
And then if you can go and give 2 breaths. Let the person breathe, twice.
Okay.
Then you press it 30 times, then you give the 2 breaths. Yeah. But the other things, when you are pressing, make sure you are just on top of the person so that you don't fold your elbows.
The arms must be
straight,
extended and locked.
Yes. So the force...
The elbow should be locked so that the force goes direct onto the chest.
Yes, onto the chest. And you push fast and hard. Yeah.
How fast?
So about 100 to 120 compressions per minute.
I don't like your description. It's too technical. What does that mean?
Well, so the key thing is push until you feel like you've hit something. If you are really pushing hard and fast, you get around that. Because if it's too fast and it's shallow, you will not...
They must go deep.
Yes, so, and as you are going deep and all that, yes. And as you are doing that, you hope that help will come soon. Yeah.
When I was trained on that, they gave us a song that we should. We should. The older people know the song, the younger people not.
To give you the rhythm.
Not so much to give you the rhythm. But if you use that, it actually gives you a beat by which you can. You know that you're singing a song in your head and you're doing it. But by the way, CPR is tiring.
Yeah, it's tiring.
It is tiring.
That's why you need help.
It is tiring.
Yeah.
If you do a bit, somebody has to take over and pump for you because Charlie, it is not. So if you look at this guy, Fabrice, was it?
Yeah.
Fabrice, he survived. He was playing, I think, for Spurs or something when he collapsed.
Yes.
They just give CPR for 20 minutes.
Yes. A2 survived. Ericsson 2 survived.
Yeah.
But Mark Vivian Foe didn't.
No, Mark Vivian Foe didn't survive.
He didn't get. Yeah. Jamla 2 didn't get.
Jamla's when his heart was
yes.
But the ability but if you've done it before, then you understand what 20 minutes of that that procedure is. It's crazy. It's really tiring.
Yeah.
But it saves.
Yeah, it
lives.
saves life. Yeah, it's very, very important because.
So if CPR is so important, why is it not taught in schools?
I think it's the awareness. So relatively, emergency medicine is, let me say, a young specialty, even if you look at the West. So now it's coming up, and maybe gradually it will get into the schools, because you have even gone to the schools. The problem is even in maybe medical school, nursing school, and all those things. It's not everywhere that we lay emphasis on it.
Yeah, that's sometimes remember.
So you may, if you cast your mind by, you notice that not really, you weren't really taking through the basic, even BLS, basic life support. So it's one of the gaps that we are looking at. But now, fortunately, more trainings are being done, and we hope that we'll get more people who be trained first responders. Because if you have more people, then there is a likelihood that if anybody has a cardiac arrest, you have somebody who has been trained nearby. Yeah. But even if you've not been trained, the things we've outlined, you can do it, and that one will save the person, because it's been shown that if like a lot of the cardiac arrests that occur outside the hospital, and for those that have the CPR done, it can actually double or triple your chance of survival. But unfortunately, they say only 4 in 10 people actually get out of hospital cardiac arrest. So if these things happen, instead of maybe pouring water on the person, calling for a pastor, putting garlic on them and all that, let's do these things. And
what doesn't work? You brought it up. Pouring water on them, what does it do?
No, it doesn't work.
It doesn't work.
In fact, it may even worsen or make the people because the water, if you don't take care, the person may aspirate.
Okay.
So it's not something that.
So water is not a good idea.
And when you are doing the CPR, you get the machine that you want to use to jumpstart it. It has to be on a dry chest. Yeah. So you doing that, you are just going to delay, because when the machine comes, you have to now clean the place and all those things.
So water is not a good idea. Is it what garlic?
Yeah. So some people to do it garlic. If people collapse and all that, they are smelling of a lot of garlic and all that.
Where do they put the garlic?
On the hair. Some too, they smear it on the whole body.
Oh, I see.
Yeah, and all that.
I didn't know it was a thing.
Yeah.
What else is there that we shouldn't be doing? What doesn't work?
Yeah, so these ones are there at times too, for the people that they think the person took some poisonous substance and all that. Some people give them palm oil.
Palm oil.
Yeah, so that
to help them vomit.
Yeah, but the vomiting will worsen the person's prognosis. Okay. So we don't recommend that you do that.
So palm oil not a good idea.
Don't induce vomiting. Some people too, they may try and insert their finger into the throat to let the person retch or bring the poisonous substance out. Yeah.
Wow. What should we have in a basic first aid kit at home, in every home?
All right, so basic. So at least your ORS, your paracetamol for common pain. You should have dressing items, basic like gauze, iodine, plaster, and all that. Yeah.
Vaseline gauze.
Yeah, well, Vaseline gauze, yes, for the burns and all those things. You can have it. Yeah, and then bandage, just to bandage and all those ones. Yeah.
Good. Dr. Blankson.
Yes.
This has been interesting and revealing.
Yes.
So you think everybody should have some kind of
training? Yes. So
everybody.
So everybody. So for those in the healthcare field, that one it's not something you can contest. Everybody should be trained. But in the healthcare, we have to also focus on we call them support staff, account officers, administrative staff, and all that. So once you work in the health space, everybody must have a certain basic training in this health, issues, how to manage the emergencies. Then beyond it, we have to recommend it. The churches, the mosque, everywhere, we have to really drum home the whole, how to recognize emergencies and what to do in case of emergencies. So even the lorry stations, like what you said, all these things, because most of the time, the drivers will be at the forefront. So we'll go there and then we teach them and train them about some of these things. And we continue to do it because studies have shown that the things that we teach, because the emergencies, we are in the emergency space, so you and I, we see them often, so it's easier. But you teach somebody and the next time you'll be having that encounter is like years later, like 4 or 5 years. So what they recommend is that maybe every year, every 6 months, you try and train again to reinforce whatever that was taught. Yeah. So these are some of the things that we can do. Then of course the schools, as you said, because these school children may have elderly parents, they may have grandparents at home. And usually if it's grandpa, they may not be strong enough to do these things. But the JHS pupil may be able to do this. Yeah.
Pastor Blankson, thank you very much. You've answered my next question, so I won't ask that question. Thank you very much. It has been quite revealing.
Thank you very much.
We need to figure out how we can train this nation in what to do in an event of an emergency, because what happens is in an emergency, there's a big man who was driving down the road and had a very bad asthmatic attack and he died. And his inhaler was under his chair. We've had people who have had anaphylactic reactions and just get this and give them a shot. It didn't get. I know somebody who died of a heart failure and just respiratory issues and for a 20 cedi drug, he died. We've lost so many people that if our emergency preparedness was better, not necessarily, I'm not talking ambulance, we are saying the things that you and I, anybody can do because it's part of, and the ideal thing is it should have been part of our curriculum from in school. Once you get to a particular stage in school, maybe JSS, we start teaching you nation building things. I put them all under nation building. Patriotism, love for nation, and this one is love for self and your loved ones. What to do in case something happens. We are very grateful to you for your time, and our listeners hopefully would. In fact, we don't want them to have an emergency to need the skills. But in the event that it happens, so they can tell the person, "Oh, didn't you listen to the program? You should have." You should have known. No. But it's quite relieving when you know that something went wrong and you were able to intervene in a manner that caused success rather than contributed to. But there are so many people who have died only because of the way they were handled or the treatment that was given to them initially. Thank you very much for that.
All right, thank you very much.
Ladies and gentlemen, we shall exit with a song labeled called My Praise by a gentleman called Gabriel. The surname is a little bit.
Zed 101.9 FM.
Thank you. Take care and God bless. Bye bye.
Zed 101.9.